And we thought that now we would just take some questions, so we'll sit.
If you would like to be asked up here, Amelia here is going to help you out. Just raise your hand. She will bring you a note card and a pen. You can write it down, and she'll make sure I get those questions from you. I have some questions prepared to get us started. So I'll just start with my first question for you. We'll get started, and then as questions come in, we'll try to get through as many as we can in our time together today. This first question, it's a two-part question, so I'll ask the two parts, and then I can repeat as necessary. But as I was reading through and even commenting on your Facebook posts, it really appeared to me, and I think Gabe, you even mentioned this a little bit about the community and sort of the commentary that developed as a part of these Facebook updates. It appeared to me that you were pretty successful at building a space for mostly civil dialogue and engagement about this information that could be pretty contentious in other spaces. So my first part of this question is, when you created this page, were you actively thinking about how to create a space for civil dialogue around this information? And the second part is, what do you think you did, whether intentionally or not, that created a space for that?
Okay, when I created the page, I don't know that it was going to, I certainly didn't know that it was going to become what it has, either in size or in sort of the quality of the community that's there. I think that there are things that have been done that have fostered a supportive community there. So the first is, I don't know if you guys remember last year, but it was kind of political whenever this happened. That was a joke. And so I avoided politics as much as possible. Everything was about politics from every place, and I didn't mention any politicians or any political parties, or I avoided politics at all costs, because as soon as I talk about politics, I lose the audience that I need to listen, frankly. So that's number one. Number two is, early on, when people would respond, and I did this purposefully, but when people would respond with a comment that was positive or that I liked, I would respond with a GIF. Generally, it wasn't words, it was a GIF, and so I think people kept coming back because I think that they liked that aspect of it, and it was usually just kind of silly. And I think the third thing is, I really focus on using analogies, humor, and simplistic language as much as I could. So, the act of becoming a physician or becoming a scientist is one that sort of socializes you into a specific language. And speaking to the public, you can't use that language. You have to go back to your human language to sort of get to them. So yeah, I think for me it was those things.
I would just add one thing, which is, if you don't know, Facebook page is mostly Gabe's. I come in occasionally, I'll do like a guest post or cover for him, if he's on vacation or something. So I'm not as active on the Facebook side of things, but I do remember one time when he left, and I was in there and I had to moderate comments and respond to people. I do remember one point where his approach was very clear to me that, and I had to learn his approach because it was not what I would have done, right? I remember somebody posted something, a comment, and I don't remember the exact words, but it was something like, all uppercase vaccines are poison or something, and then would just repeat that over and over again and spam. I didn't like the comments, and so my first reaction was just ban that person instantly, right? Because as a moderator, I could do that and just be like, goodbye, you're gone, right? And obviously before I did that, because it was Gabe's page, I checked with Gabe, and he's like, no, that's not really the approach we want to take. Here's what I do. We try to respond to the person, maybe do it individually, message them individually, try to talk to them. And we don't want to be a place where if you say anything controversial that we disagree with, we kick you out. And again, I'm not on the Facebook page every day, but when I am, I'm always amazed because you still have people posting that, but the community has figured out how to deal with it. And instead of everybody getting upset and complaining and replying and trying to dissuade that person, usually you just nobody replies to that at all. Or if they reply, they just reply with the laughing emoji. And that's it, right? And that's the only feedback that they get, because I think those people often are looking for a rise and looking for a reaction. And because it's a community, the Facebook page has become a place where people know that, and they don't give them that satisfaction of getting a rise out of everybody. And I think that's really made it a wholesome place. And then people can't point to it and say, yeah, well, you just ban anybody that doesn't, agree with
I banned 2 people, and both are just abysmally bad language. You know, you're never going to convince someone in the comments that their opinion is wrong, and I realized that relatively early. And so the tack that I took, to be completely frank, is when you set up a Facebook page, when someone replies, you can message that person individually directly from the page. So they'll get a message from the Who's Your COVID-19 Update page. And so when I get people who are sharing this information, I will message them and just say, hey, you know, I'm happy to talk about why, you know, this specific thing is wrong. If you have real questions, if you're just here to kind of, you know, make trouble, then that's okay. We would rather not have that here. But you have a specific question, and literally, there have been 2 or 3 people that I've flipped. Like you don't do it in the comments; you do it individually. So that, and I'll be honest, from my perspective, that's been the most rewarding aspect, is those interactions. So,
Absolutely, thank you. Gabe, at one point we were talking earlier, you talked about part of your role is to talk with your medical students about those different channels of communication, the cognitive, the emotion, the meaning making. So which of these channels do you feel you drew upon the most in sharing these regular updates, and how did that affect what you were able to do with this page?
yeah, so I guess the background behind that, for those of you, because most people haven't probably heard this. So if you ever read a book, there's a book called Difficult Conversations. And so I teach physicians how to have difficult conversations with family members. And we teach that every conversation, especially when it gets difficult, and this isn't just for medicine, so this is for life in general, has 3 channels. There's a cognitive channel, what's going on, and the emotive channel, how do I feel about this, and the meaning channel, what does this mean for me? And you know, the most effective, when conversations are hard, the most effective communicators don't talk to the cognitive channel, they talk to the meaning, the emotive, and the meaning channel. And so, you know, what I try to do, certainly the page has the cognitive channel on it, right? The page has graphs and a very quick summary of the data and a commentary on what's going on with the data. So that is a cognitive portion. But then, in my opinion, most of the benefit of the page is the commentary below, where we interpret it. And so that is taking hard data and turning it into a meaning channel message. What does this mean for me, right? You know, I can remember a post where my wife and I sat down and was like, okay, this was like May of last year. How are we going to handle the summer? What things are we going to do? What things are we not going to do? Where are we going to wear masks? Where are we not going to wear masks? How are we going to do traveling, etc.? And I put it into a post, like, here's what all of this stuff that's going on means for my family and how we're going to handle things. And so, from my perspective, communicating science is distilling cognitive channel stuff into a meaning channel message. And that's really what I've tried to do, and I think Micah's tried to do on Twitter as well.
Yeah, I do think that, like, once you kind of pass some of the emotional and meaning stuff, then people are ready for the cognitive stuff, right? I mean, once they've kind of calmed down and, okay, I understand what to do, now I want to see the data. And so I've done folks a little bit more on that because, you know, as an economist, I just want to see the data, right? Like, I care less about the meaning and the emotional stuff, although I'm learning to care more about that, especially, you know, watching Gabe talk to people. But for me, I mean, you have to have, like, that cognitive base there ready to go, so that once they're, okay, I'm not freaking out about the summer now, let's go look at the cases, and you know, I'll be able to kind of put that more in the context as well. So it's really kind of bridging all of those together. But I think you have to start with the emotional, the meaning stuff, because if you don't have that, then you're not ready.
But the emotional conversation is based on the data, right? So I posted yesterday on Twitter, hospitalizations are up 68% in the last 2 weeks in Indiana, which is true, which is insane, and which is very scary for me and for my colleagues. You know, what is the meaning of that? The meaning, and so the rest of the tweet was, get vaccinated if you're not, and get your booster if you haven't yet. And so I'll say that to all of you too. If you're not vaccinated, get vaccinated. Because I've had patients, I can promise you, I have personally lost a COVID patient that is the age of every single one of you. So if you're not vaccinated, get vaccinated, and if you're not boosted, now's the time.
Thank you. I have a couple of questions here that have come from the audience just around misinformation and how you're combating that. So one is specifically about how do you feel about Facebook being used to spread misinformation, and how do you feel like you have helped combat that spread? And the second part of that question I'll add is, how do you avoid burnout communicating to combat the misinformation?
Well, I mean, it's hard. You're just one person, right? And misinformation spreads like wildfire. So, you know, one person responding cannot possibly deal with, you know, all of the misinformation that appears daily. And so if you want to try to prevent it all, you can't, right? There's just no way. I think the best you can do is be a source of good information and just be kind of, just constantly repeat that and bring that good information out and don't have the goal of like, how do we stop this misinformation from happening? You instead just have to say, okay, here's the good information, listen to this, and people will over time, okay, be cautious about misinformation. Because there's no way you can keep up with like the wildfire of misinformation, but what you can do is slowly kind of push back the fire around. And it is exhausting, and you definitely hit your limit, and you have to know what that limit is. There's times when I'm like, I'm just like physically burnt out with social media. I'm just like, I'm done with Twitter, Facebook today, and I'm not going to open it again today because it's just too much. Right. But at the same time, there's whole networks of people that are fighting misinformation, and if you connect to them, it really helps. So I have a lot of people that have contacted me from parts of Facebook that fight misinformation to ask, hey, can you give me a quote about this, or where can I find data on that? And so we're all out there fighting it, and we're all way more persistent than the misinformation. Right? Misinformation is like a fad; it comes and goes, but the good information kind of sticks around.
I would say I don't like Facebook as a general rule. I frankly think it's an evil corporation. And as soon as this is over, I will shut my Facebook page forever, and my Facebook account forever. At the same time, I do think it is incumbent upon us to be in the space to combat the misinformation, because me just leaving isn't helpful right now. The burnout, though, is real, because I get the same tired arguments that I got a year ago still today. And so that burnout is hard. So there's two things I do to combat that. One, I have a document that is basically things I've written about literally all of these, so I don't have to rewrite anything. I copy and paste stuff for the most part and just tailor it to what they're asking me, so I don't have to do a lot of cognitive work for those old, tired conversations anymore. And the second is the learning curve early on to figure out who was actually arguing in good faith and who was just trying to be a troll was steep, but I'm now pretty good at understanding who that is. And anymore, I kind of just flat out ask them, boy, this is a lot of misinformation. Are you interested in real information, or are you just trying to get a rise out of me? And I can usually tell from their response which way they come. And if they're magical thinkers or they're just trying to get a rise, I don't honor that with a response. I just ghost those people.
So I have a question here from the audience about how did you decide what data was relevant or needed to be shared? And secondly, what limitations did you face, and how did these limitations influence those decisions?
Ooh, yeah. For me, at least, it's a lot of it's trial and error. Like I haven't quite caught up to Gabe, but I'm almost to the number of tweets he's tweeted in his lifetime, and he's hadn't got much longer than me and a lot bigger. And it's just throwing stuff out there to see what sticks, right? So some pieces I'll have a graph, I'll make it quick, I'll stick it out there, and sometimes it really connects to people, and I'm like, okay, that's what people are looking for, that's what they're interested in understanding, and then I kind of go down that alley. Other times I'll spend like a couple hours making a graph and like nobody cares, right? Which is fine. And often it's driven by what's available, and thankfully for us, stuff has gotten more and more available as we go. Again, if you think of that graph that I showed, the first version of the dashboard, nothing was available. You had to like pull data from wherever you could get it and try to, someone would ask you, what's this data? And you're like, I don't know, but here's the closest thing we can get. Now it's getting much, much, much better. So like the CDC has now fantastic data resources, almost to the point that like the state dashboard is almost becoming redundant because they have such good data. And so if you want to know about vaccine effectiveness or who's getting hospitalized by different age and different vaccination status, you can get that data now, and that's made our life a lot easier. Before we had to get at it kind of tangentially. So someone would ask, hey, can you give me hospitalization data for Marion County? I'm like, well, I can't do it at the county level, you do it at the state level or this level or the district level, and so you couldn't get at it directly, but now it's getting much, much easier as the data quality gets better. And I think that's part of the reason that it helps us keep going, because if we still had to kind of dig through the earth to try to find something close to the data, it would just be so much work. Whereas now, it's most about we know where to go. So if someone's like, hey, how many ICU beds are filled up in this county, you can just pull it up real quick and easily, and it saves us a lot of time.
Yeah, I can remember early on, remember when you used to screen scrape the
I still do some of that. So there's still parts of the data that where you actually have to just like mouse over each data point, write it down, mouse over each data point, and sometimes going all the way back to like March 2020, it takes a long time, but there's a lot less of that than there was.
And I'd say that being a physician in the hospitals for me has made figuring out what data is relevant easier. Like this is the advantage that I have over Micah, and this is why our collaboration is helpful, because he's very good at finding data and creating these visualizations that are just really, I mean, the graph with the red and blue art is just, oh my gosh. And I could probably learn how to do that. It'd take me days. But for me, deciding what data is relevant, to me, I start at the meeting channel, right? So I'm in the hospital. I'm seeing all these patients come in. I'm like, oh my gosh, there's so much more COVID in the hospital now. All right, is there data to back this up, or am I just seeing a local, something local weird happening? And so I can go to the data and be like, oh my gosh, yeah, look at hospitalizations are going up, or look at hospital admissions are going up. And so I can relatively easily get a story from in the hospital and then go to the data and use that data to tell that story as well. The other story that we told, I think, really well early on was the story of the vaccinations. The story continues, right? So, I was just at Eskenazi Hospital this weekend in the intensive care unit. 40% of my patients in the ICU had COVID. None of them were vaccinated. And you can go to the data, and the data tells you that as well. Like, there are almost no vaccinated patients in ICUs in the state of Indiana. And so, for me, going and proving that what I'm seeing locally is what's happening that has external validity is part of the process of telling that story and deciding what data is relevant.
I do have one question here about how you respond to doctors who are spreading misinformation.
Oh my gosh.
I defer entirely to Gabe, because again, not being a doctor, I have no standing ability in that. I have no position to argue.
So, yeah, this is frustrating. Actually, when I was on CNN on Dunland, and that's what that was about. It was about, there's one doctor here in the state that has really spread a lot of disinformation. And so how have I handled that? Well, when that doctor went to a school board meeting, that went viral. People probably remember that. And so I wrote a whole post about it and really broke down point by point why what that guy said was just factually incorrect, which it is. But the other way I combat it is, I said earlier that you don't convince anyone in the comments section, and that's true. And so, in the spirit of putting my money where my mouth is, I met with that guy. I know one of the state senators, and the guy wanted to meet with the state senator, and the state senator said, will you meet with me and this guy? And I said, sure. And so he and I sat down and had a conversation. He is not convincible, and he is, people die because of what he's saying, but I tried, and that's the best I can do. I'll be honest, I think that we as professions by definition are self-regulating, right? The medical profession is a self-regulating entity. We regulate ourselves. And the state, I'm going to be honest, and I'm going to go on record here and say the following. The state medical board is doing the profession of medicine a disservice by not what's the word? I don't want to say censoring, but by not sort of calling this person out. Because if you look at the bylaws of the state medical board, this guy has not fulfilled his duty as a physician. And my personal opinion is that medical boards and our licensing bodies, which are mostly physicians, need to self-regulate these individuals who are clearly spreading information that is empirically false. Empirically false. I'm not talking about differences of opinion on whether, I think you can reasonably disagree about whether children should be vaccinated. I think they should be vaccinated, but I think there are people who say maybe they shouldn't, and I think those people have a modicum of an argument. But to say that the vaccine is killing more people than it's helping is an empirically falsifiable statement. And when a physician says that in a public arena, including in the State House, to legislators, that person should be punished. I got a card now.
This next question is about kind of your respective fields coming together around this project, because this work is it's related to your respective fields, but not something that one might typically expect given your primary roles that you've identified. So when you were first starting out, did you anticipate taking a more interdisciplinary approach to your work? And what advice would you give students who are interested in taking an interdisciplinary approach to their field of study, especially in terms of communicating with the public?
I mean, look, I love this. Although I'm kind of wired to love this, right? I love behavioral economics. I've read all of, Nudge and sort of all these books that are by behavioral economists. And so I'm thrilled with this. And I'll be honest, I have other projects for Micah and I to work on going forward, because I think there is the benefits of interdisciplinary work are massive, because getting out of your silo is a way to foster innovation. Did I anticipate this? No, I didn't. It's one of the benefits, frankly, of being on Twitter, is that I get exposed to things that I normally wouldn't. But yeah, I think it has massive benefits.
Yeah, no, I mean, I don't think we expected. Like, I think at some point we were kind of like, yeah, we're eventually probably going to write something based on all this data that we've gotten. And I like what Gabe said about Twitter. Like, I hear all sorts of viewpoints. I get messages from people all the time. I try to always respond to them. But I think in terms of like maybe advice to give you is, before I went to grad school, I was like, what is an economist? It's this person, right, that has this PhD and does stuff. And then I went to grad school. I'm like, now I'm an economist. But I think it's kind of a misleading view, because being an economist or doctor, it's kind of like what you do and what you know, but it's really not at all who you are, right? And I think that's been really important for me to remember, is that we're all just people. We have different backgrounds and different experiences and different knowledge and different information, but we're all still the same people. And so it's important that as an economist, I want to be able to sit down and talk to a marine biologist and have a useful conversation. I also want to be able to talk to somebody that was never even been to high school. Because we're all the same people, we just have different backgrounds and different information. I think especially as you get through higher education and maybe you go on graduate school or something like that, it's really easy to get siloed off. And I think you have to try to break those down. So often, like if I'm at a conference, I'll try to find somebody that's like the least like me. Maybe they look uncomfortable because they're not familiar with the research or what's happening, or even being at a conference. And I want to talk to them, I want to hear from them, because that's where like I can help maybe the most, and where I can also learn the most, because we have such different backgrounds. I don't want to go and find the only other economist and have the two of us talk about monetary policy or something. That's not fun, right? It's interesting to get different perspectives. And remember that all these things that you've been trained to do, those are your training in what you do, but really not who you are. And that's kind of the important thing for me.
Fantastic, thanks. This question here is about getting best platforms to get information to children and younger adults. And so when using TikTok or something more relatable to that, but what do you think would be most effective in getting that communication out to these younger populations?
Ooh, I don't know. I mean, we've talked about doing a TikTok video, but I think it's beyond both of our capabilities. I almost thought about the other day doing one, but it's just the learning curve is pretty steep. I don't know. I think it's just getting the information out as far-reaching as you can, and opportunities will arise. Like I had the other day, a high school teacher just messaged me. It's like, hey, can you record a short video? I want my students they're doing like a news update for the school, and they want to put a little video of you talking about this thing you talked about in the newspaper. And I made a short video, and I haven't heard back, but presumably they're like airing it on the high school TVs or something, right? And so I think that eventually you have these opportunities, and you have to just be ready to take advantage of them. So if someone came to me and was like, hey, let's do a TikTok, I know how to do it, I'd be like, absolutely, let's do it. Right, but just kind of going into it cold without any experience is tough, right? So maybe look for those connections and collaborations and be open to them.
Yeah, I agree. I mean, I think about doing TikTok and it makes me anxious. My sons are on TikTok, and like I see physicians my age doing TikTok, and I'm like, oh my goodness. So I don't know what the best way is. I mean, I'm going to keep doing Twitter, and I do a little bit of Instagram, but I don't do a ton of this on Instagram because I don't find it to be a good platform. Instagram is the marketplace of selfies, and Twitter is the marketplace of ideas. So, yeah, I mean, maybe at some point we'll do TikTok, but I don't know.
Well, the other thing too is that we don't have to be the main people to spread the information.
Right, yeah.
Like I have stumbled across like my own graphs on like Instagram. Like other people have been sharing them, and that's why like when I do a graph, I always put my Twitter account in part, not because I want to get followers, but because if somebody wants to learn more, they know where to find me. If they're like, this graph is dumb, then they can go complain on Twitter to me, and I can engage with them there. So we don't have to be the primary source of information on all the mediums all the time. sometimes we like rely on you guys to like echo it.
Yeah, if one of you guys wants to just take what we do and turn it into TikToks, go for it. Like, take it, it's all yours. It's all out there. Go.
Well, in the vein of all of these different platforms we're talking about, what would you say in updating this page has taught you about, one, how people consume and make sense of complex information, and two, what helps people trust or not trust certain information sources?
I mean, I think they trust sources that they know, right? And so if you know somebody, and this is, I think, one of the big problems with Facebook is that your network is often based around who you know, and so that if your brother starts sharing something, you're more likely to trust it than like some random person on Twitter. So that's really hard to combat. Yeah, I don't know. It's really tough, I think.
Yeah, I think there are things though. I mean, in the language that you use. So admit when you're wrong. Use humble language. You know, I think X, I worry Y, instead of cases are going to go up. Right? You'll almost never see me say cases are going to go up. What I'll say is I'm worried that cases are going to continue to rise. Right? And I'm very specific with that language. Because I don't know, right? So using humble language, admitting when you're wrong. I've been wrong. Oh my gosh. I truly, in July 1st, our new fellows come. So 7 new fellows. We do an orientation month. But the first day we do a thing at Eagle Creek where we go and we kind of get to know each other. And I give a little overview of the program. And so July 1st of this year, I told the fellows, I took out my COVID slides because COVID is over and I don't think we're going to deal with surges anymore. Oh my gosh. And then when the September surge ended, I was like, I don't think this could possibly happen again. And it's happening. So admit when you're wrong, use humble language, use humor, people, talk like a human, right? Talk like a human to other humans. Humans want to be talked to like humans, not like patients, not like consumers. They want to be talked to like humans. And so, you know, keeping in touch with your limbic system, which is your amygdala and your hippocampus, which are the parts of your brains that do emotive communication, is important. And I've talks about sort of how to do this, but you know, a lot of us, that part of our brain atrophies as we get socialized into our specific specialty, and that's a shame.
Yeah, and you know, as you do research, you tend to get more and more into the technical details, and it's really important to back up. It's kind of like those technical details have to be there, right? But that's not how you're going to explain it to somebody, right? If somebody else is familiar with it, you know, what you're talking about, great, they can look at the technical details. But if some random person walks in off the street and knows nothing about what you're talking about, you have to be able to explain it to them, especially in a humble way, because I think we've seen a lot of the people over the course of the pandemic who have kind of lost a lot of credit and have kind of really come down and said, this is what's going to happen, and then it didn't happen. So we're very careful not to say, this surge is going to lead to X number of cases or anything like that. I mean,
I'll say it to you in a DM.
Yeah, we have like private back channels where we do bets and things like that, but I've lost most of them.
Oh my goodness, this has been fantastic. We are at time, and I know we have lots happening this morning, so we want to get to that. So I want to take a moment and thank you both for sharing your time for these past 18 months and your time here with us today to help us learn more about this really phenomenal way you've communicated this data. I know I said this morning that this has helped me stay sane, especially as a parent during COVID-19. So I really appreciate it, and thank you both for being here today.
We're all doing. So kudos to you, because there's some really cool stuff happening here.